it's a local immune response. Why it's a local immune response? Firstly, why the local immune response? Actually, when inflammation happens, there is a more chances of vasodilation of blood vessel. For example, the normal blood vessel, blood flowing here. When more vasodilation happens, when there is more distance between two vessel wall, it means slows down of blood flow, slows down of blood flow. When more slows down of blood flow, the white blood cells that are present in the fluid, the leukocyte that are present in the fluid, they goes toward the vessel. From where they go? They go toward the wall of the vessel. When they goes toward the wall of the vessel, the endothelial cells that are present in the wall of the walls, they contract. The endothelial cells the endothelium cells that are present in the wall of the vessel, they contract, that allows to go fluid toward the tissues. That allows to go fluid toward the tissues. Now, what's the next condition happens? For clinical signs produced, for clinical signs during inflammation, one is swelling, other is pain, the next is redness, loss of sensation. When these clinical signs you found, when these four clinical signs you found in the infection side, also burning also happens, burning. During these conditions, blood pressure increased, when loss of sensation happen, it's mean temporarily receptor block in the infection side. Another point I want to explain you that inflammation are two types. The first, which is acute inflammation, the second, which is chronic. Let's discuss about acute and chronic. Acute inflammation, it's a very short time period. It's a short term period in which within 1 minute or within 1 hour. The symptoms, the clinical sign shows within 1 minute or within 1 hour. That's a acute inflammation. For example, asthma. And chronic inflammation means the clinical signs shows is that type of inflammation that happens after acute. It also happens suddenly, but it's a long, slow stone of progression type of inflammation, slows down progression type of inflammation that going and that shows after few weeks or after few months. That is known as chronic. For example, arthritis. Which are present, these arthritis the present in the knee joint. So I want to explain you again these all types of inflammation. Firstly, we are talking about inflammation. It's a local immune response. It's a local immune response in which infection happens, in which some clinical signs produced, the infection experience, which is swelling, redness, pain, itching, loss of sensation, burning, and your blood pressure increased. Then there is blockage of receptors, the temporary blockage of receptor that is not taking signals from skin, from the damaged area. That is known as inflammation. It's due to the more vasodilation. More vasodilation happens, slows down of blood, slows down of fluid, and more slows down of fluid. The white blood cells down and goes toward the walls of the vessel. When white blood cell goes and toward the wall of the vessel, the endothelium cells are more contract. When endothelial cells are more contract, they allows the fluid towards the tissues. When they allows the fluid toward the tissues, the clinical signs produced, these are swelling, pain, redness, and loss of sensation. Two types of inflammation, acute and chronic. Acute after 1 minute or after 1 hour. For example, asthma. And chronic, these types of happens after acute. It also happens suddenly in certain condition, but it will be after few weeks or after few months. For example, arthritis, the knee joint. So thank you so much, guys.